Other states, along with Washington, D.C., are joining top Democrats in expressing skepticism over Operation Warp Speed, the Trump administration's private sector-led push to get a coronavirus vaccine in record time. New York State, as you may recall, has suffered far and away the highest number of deaths from COVID-19, more than double the number of New Jersey, which has the second most deaths and is still reeling from lockdown. So it would stand to benefit from a safe and effective vaccine. Correspondent Aisha Hasmi reporting live for us tonight from New York City. Good evening, Aisha.
Good evening, Shannon. Yeah, so New York State Governor Andrew Cuomo seems to believe that politics has somehow poisoned this process of creating a vaccine. Take a look for yourself. These are the top 3 contenders for a COVID-19 vaccine, according to the Wall Street Journal, aiming to at least file for clearance in October. Now, even if any of these vaccines are approved by the FDA, New York State can delay distribution to its 19 million residents. The state is creating its own health task force that will decide if a vaccine is truly safe and effective, and also who will get it first. This as concerns grow over whether corners are being cut to rush a vaccine before Election Day. Now, the director of the National Institutes of Health has vowed to uphold all safety measures, but Governor Cuomo says the whole thing has become way too politicized.
Frankly, I'm not going to trust the federal government's opinion. And I wouldn't recommend to New Yorkers based on the federal government's opinion.
Now, the question, Shannon, is can the state of New York legally prevent residents from getting a potentially life-saving vaccine? And the answer is yeah. Fox News senior judicial analyst Judge Andrew Napolitano told me tonight when it comes to health and safety, states can impose stricter rules than the federal government. So it looks like, at least for this one, Shannon, that Cuomo trumps Trump. Shannon?
Okay, those two have butted heads over many things in recent months. Aisha, thank you.
You bet.
So what about Governor Cuomo's pledge, not going to authorize the vaccine, a quote Trump vaccine, for the people of New York without having state officials vetted first? Let's talk about Operation Warp Speed and the healthcare reforms the president rolled out today with Fox News medical contributor and author of the new book, The Price We Pay, Dr. Marty Makary. And Fox News medical contributor, author of the upcoming book, COVID, The Politics of Fear and the Power of Science, Dr. Mark Siegel. Doctors, good to have you both with us tonight.
Hi, Shannon.
Good to be here.
All right, Dr. Siegel, I want to start with you on this threat from Governor Cuomo. How do you think this benefits or doesn't the people of New York, saying, listen, even if the FDA approves this thing, we're going to have a whole other vetting process before you can get it here in New York?
I don't think it benefits New Yorkers. I do think that the Judge Napolitano is right, that the state is where healthcare is centered, so he probably has the right to do this. Here's the problem, though. The problem is 90% of our restaurants here in New York are reporting they can't pay for their rent in New York City over the past month. 90% couldn't meet their rent, so we're going to see more and more restaurants closed. That's part of public health, too, Shannon. And in order to get back on our footing, on our feet, we're going to need a vaccine. And the federal government isn't President Trump with this vaccine, it's the FDA. And I was looking over the FDA advisory committee that's going to be meeting on October 22nd, and these are some of the top scientists and vaccine experts in the country, and they're going to look over the data of the Pfizer vaccine, of the Moderna vaccine, later the AstraZeneca vaccine, Johnson & Johnson, and there's 2 coming up in the rear, Novavax and Sanofi, are amazing vaccines, and they're going to decide when the data warrants approval. And the state can slow that down, but that's going to hurt citizens who are at big risk, and it's going to slow down the process.
Okay, I want to talk about the other big healthcare news of the day. The president rolling out new options, new things that he says will modernize and replace parts of Obamacare potentially. And I know that Dr. Makary, you gave the White House some advising on the price transparency part, the part about letting people know what they're going to pay for something and not have surprise medical billing. Well, today the Washington Post said this was their headline: after years of promising his own healthcare plan, Trump settles for rebranding rather than repealing Obamacare. What do you make? How do you assess what the president rolled out today, knowing that you gave him part of the advice for part of this plan?
Well, Shannon, the fundamental problem in healthcare is that we have non-competitive markets. And when you see non-competitive markets with price gouging and predatory billing and surprise billing, the temptation from a policy standpoint is to create rules within that marketplace. But the massive transformation that has been necessary, and the reason that President Trump's move has been hailed, is that it transforms non-competitive markets to competitive markets, requiring hospitals to have prices for common shoppable services and to disclose the secret discounts between insurance companies and hospitals. You know, some of fixing healthcare is actually remarkably simple. It's getting rid of kickbacks to middlemen, and it's getting rid of secret pricing. That will transform the marketplaces, and that is what people are saying now is a massive milestone, because no one has been willing to tackle insurance companies, the pharmacy benefit manager middlemen who get the kickbacks called rebates, and no one has been willing to tackle the American Hospital Association on a lack of transparent pricing in America, or Big Pharma with this new international pricing index to anchor prices until now. And that's why many people are saying this is a massive milestone, bigger than anything we've seen in the last 50 years.
Okay, can I ask you both quickly, because we got to go. If the FDA, once it does give approval to one or more of these vaccines, would you feel comfortable recommending them to your patients? Dr. Siegel?
Yes, absolutely. And I would start with patients at high risk. And I would start with healthcare workers that are on the front lines taking care of COVID patients. The key here is, which are you more afraid of, the virus or the vaccine? That's an easy one in this case. Something like the Moderna or the Pfizer vaccines, Shannon, those tend to have flu-like side effects. That's what we're seeing. And you might feel bad for a day or two, but then get better. The virus, you feel bad for a lot more than a day if you get a severe case.
Yeah. Okay, Dr. Makary, we got to go. So yes or no, with FDA approval, would you be comfortable?
Absolutely. I've served on the data safety monitoring boards in the past. There are 3 independent boards of private physicians. To think they're interfered, that's laughable.
Okay. Doctors, thank you. We always appreciate your expertise. Very kind of you to lend it to us.
Thank you.
Okay.
Thank you, Shannon.
Coming up, Howie Kurtz takes a look at the divided media reaction to the Breonna Taylor grand jury decision and the protests that followed.